Let's see if we can fix that. Hello, all you cool cats and kittens. It's Katie. It's 3 o'clock. It is Wednesday, and I'm about to have a conversation with Dr. Maria Van Kerkhove of the World Health Organization. She's somebody, hi everybody. She's somebody that I've been talking to. Pause due to poor connection. Can you all hear me? Here, I'm going to raise my volume on my phone. Can you all hear me okay? Will someone give me a thumbs up if you can hear me? Stinking cute 7. Hey. But I hope you guys can hear me okay, because we're getting on with Maria Van Kerkhove, who's going to be joining us momentarily. Why don't you maybe come from this way? Because we're going to get the latest on the pandemic announcement that he's going to stop funding the WHO. This has been turned into a real political hot potato. Maria, hi.
Hi.
How are you?
I'm okay. How are you?
You look amazingly well rested for someone who I believe must be working 24/7.
I'm a little tired. I'm not
Are
gonna lie.
you?
I'm a
Well,
little
and I
tired.
know, and it's 6 hours ahead there, right?
Yes, it's 9-ish.
9
p.m.
o'clock. Well, thank
Yeah.
you. I know that you're tired, but I really appreciate your spending a little time with us. Can you explain for people who are joining, Maria, who might not have seen previous conversations that you and I have had, what exactly your role is at the WHO?
Yeah. So, Katie, thanks for having me again. It's always nice to chat with you. So I work at the World Health Organization, and I'm what we call the technical lead for the COVID-19 pandemic response. That basically, I'm an epidemiologist. I study these epidemics and why they happen and why sometimes they take off and why sometimes they don't. And I lead a team that develops our technical guidance for countries, basically to say, what do we do? How do we find this virus? How do we protect people? How do we care for people? And I have found myself sitting next to the Director General and Dr. Mike Ryan 3 times a week doing press conferences, answering questions from journalists and from people who have a lot of questions, rightfully so.
Well, I think we're still sort of in the middle of this whole pandemic. And I thought well, by the way, my friend Nora O'Donnell is joining us, and I think Chasten Buttigieg too. So it's nice that we have these conversations. Again, I think they're so helpful. And we haven't spoken for several weeks, Maria. How would you assess the last few weeks in terms of where we are, both in the United States and globally, when it comes to the coronavirus?
Yeah, I think you have a better sense of exactly where we are going on in New York, but I think globally it's a mixed picture. What we've seen in Asia is that in general, we've seen quite a decline in cases, where we've seen the efforts that they've put together to find cases and isolate cases, find all the contacts, quarantine them, care for patients have really paid off. It's really, really reduced case numbers. Some countries in Asia have now started to see a resurgence because of importations, which is an important lesson that we need to listen to, and we'll come back to that. In Europe, we've seen an explosive growth in terms of case numbers in the last several weeks. Some of those countries we think are starting to level off, which is good news. But it's come at the expense of putting in these very drastic movement restrictions and what some people are calling lockdown.
Yeah, Maria, I noticed that in places like Italy and Spain, there's good news one day. It seems to be leveling off, and then it'll suddenly spike. So, do you have the explanation for why that's happening? And of course, there are a lot of concerns that this could happen in the United States as well.
Yes, I mean that's a good point. Anything that is happening in other countries can happen everywhere. So it's all a matter about how we look, how we find, and what we're doing with these patients. How are we restricting the possibility of somebody that's infected from infecting somebody else? The situation in Italy and the situation in Spain, they had a massive growth. They had a massive outbreak, and the deaths from those infections sometimes take some time to register, because it does take time for people to reach their outcome, whether that is survival or whether that is death.
Right.
So
So the data kind of lags right
it
now.
does. It does.
Yeah.
It does. It lags, and it's not just the numbers. It's about where do those numbers come from. So when we look at these numbers, there's numbers everywhere. There's dashboards everywhere, but the numbers you have to figure out, like, how are people actually looking? What is the testing strategy? I know there's a lot of discussion around testing in the States, but elsewhere, not just the US. Um, how hard are we looking? What is our strategy? Are we only focusing on the severe patients who need critical care, which is an important strategy, or are we trying to find every single case?
Right.
So that matters in how you interpret those numbers.
A couple of things. We still don't know how long you might be contagious if you're asymptomatic. There's so many unknowns. Do you have any insight into that?
Yeah, so every chance I get when I talk to anyone from the country who's looking at this, the question I ask is one, where is transmission occurring? Is it happening in a household? Is it happening in healthcare facilities? Where is it actually happening? And secondly, among the people that you're identifying, how many are asymptomatic? And when I say asymptomatic, I mean people that are positive with a test, but never develop symptoms. But that's not how the world calls asymptomatic. Everyone is saying everybody's asymptomatic and it's transmitting everywhere. That's not true. What we do know is that there are some individuals who are picked up early because contact tracing in some countries is very, very good. So
Right.
they have a number of contacts on their radar. And when they follow them over the 14 days, some of them get picked up through PCR testing. What information I have, it needs to come from studies. I mean, I'm a scientist, so I like the studies,
Yeah.
but as much information as I can grab, it appears that the asymptomatic or pre-symptomatic, meaning somebody who is a few days before they develop symptoms, that amount of transmission is very, very low. It's
So
possible.
it's mostly people with full blown coronavirus who are transmitting the virus.
It's people with symptoms.
Right.
And from the data we have from the lab, people with even with very early symptoms, so even just feeling a little bit unwell, they can transmit. So when we say if you're unwell, stay home, that doesn't mean, full blown pneumonia. That means if you're really feeling unwell, please stay home. Call your doctor and figure out, like, do I have a risk? Do I have any risk factors? And then they can decide what to do next. To say that, it's hard to say that at a global level when you really need to make individual decisions.
Yeah. By the way, we're talking to Dr. Maria Van Kerkhove, and she's with the World Health Organization, and she's an epidemiologist, generally just a major smarty pants and a brainiac. And by the way, Maria, your mom is watching, and she says
Uh-oh.
hi, which is so sweet. So, no, I think that's so nice. I know she's
You
so
know,
proud of you,
I,
and a lot of people are really proud of
can I
you
say,
who are joining us.
can I just say that the amount of support that personally I have felt from my friends and my family, the amount of support that WHO has felt, like, globally, it's so heartwarming. I love it. I absolutely love it. We take the criticism, and that's good too, because we all need to make ourselves better. But I do love say hi to my mom. Hi, mom.
And your dad's watching too, by the way.
Oh, hi, dad. Hi, dad.
Listen, you brought up the criticism, so I, of
Yeah,
course, have to ask you about this
sure.
news that the president announced that he was going to stop funding the WHO. And I know the United States is the biggest funder of the organization with about $400 million a year. And I'm curious, Maria, I know you don't want to get too political, and I don't want to put you in an awkward situation, but I'm curious how you and your colleagues are responding to that, and just what your reaction was.
Well, I mean, personally disappointed. And the DG covered this in his speech tonight, so I think people should look at that, and what he specifically said around that. U.S. is an incredible supporter of WHO. We work with U.S. CDC colleagues and academics daily. They sit with us in our meetings. They debate with us. And when we say debate among scientists, I don't mean that in a negative way. It's always kind of a nerdy debate. You brought up the nerdy part, but it's definitely a nerdy debate. We love the U.S. I'm an American. I'm a proud American.
You're from
And
North Carolina, right?
well, actually, I'm from New York. So
Oh,
my sisters now live in North Carolina in Zebulon. But was born in upstate New York in a little town called New Hartford, New York, right near Syracuse area.
oh,
So
okay.
I'm a New Yorker, I have to say. I lived in Manhattan for 5 years before I moved to London. And then my husband and I moved to London. We lived there almost 10 years, and then 2 years in Paris, and now we're 3 years or so in Switzerland. So we feel very, very lucky. But yes, New Yorker at heart, I guess.
Okay, sorry, I take back the North Carolina thing, although that's a nice state too.
North
uh,
Carolina is
so
wonderful.
So I was going to say, I mean, one of the major criticisms the president has had of the WHO, and we'll try to get to some of your personal questions, everybody who's watching. I just want to talk to Maria for a minute about sort of how now it's become sort of this political hot potato. He said that opposition to closing travel from China to the United States that was expressed by the World Health Organization was kind of disastrous. And I'm just curious if you can explain the backstory to that. Was the WHO opposed to it? And do you think ultimately that it was the right decision?
Yeah. So, in the beginning, when I actually went back and I was looking at some of the early emails and I was looking at some of the early discussions that we were having around this. And my first press conference ever was on the 14th of January. I've never done a press conference before and didn't actually think I would be doing things like this. But in the beginning, when you learn about a pathogen at the time, around the 14th of January, there were 41 cases. There were 41 confirmed cases, and it was a cluster. And when you have these emerging pathogens, what normally happens is you see this activity and you see these clustering of cases, and you do as much investigation as you can to figure out what is actually happening. Where did it come from? How are people getting infected? How do we prevent people getting infected? And then you plan. You prepare. So we came up with a number of scenarios ourselves about like what could potentially happen and what would transmission look like. Would it be restricted to Wuhan? Would it be restricted to Hubei? Would it be restricted to China? And then could it get broader? The reality of the world that we live in is that we are so interconnected, and we are so, these viruses don't respect borders ever. So the fact that you could potentially close something down could have a devastating impact on economies, could have a devastating impact on moving things around, which is exactly what we're seeing right now. We can't get supplies to places that we need to get supplies. We can't get people. We can't get technical expertise to where we need to get technical expertise. We're trying to get creative with it and using technology. But there will be a time where we will go back and we will look through point by point everything that we did. We do this all the time. It's called an after review. And that will happen, and there will be a time and place for that, and that will be done by our external bodies and people that hold us accountable. That's not something specific for the pandemic. That's something we always do. Right. But I can assure you that we are always questioning ourselves too, of like all of the things that we could be doing and all of the things that we could be doing better. So we that will happen. We need to put out the fire right now. We need to have everybody focused on what we need to do to stop this.
Do you a couple quick questions from that answer, Maria? So do you think it was helpful to stop travel from China to the US, at least while other things got put in place? Some might argue legitimately that it took a long time to get some of the other pieces going, but was it effective?
Well, some countries that implemented this did see some benefit of that, but it's not something that can be done in isolation. The hesitation that I have in this is that by putting in a restriction and not doing all of the other things that you need to do, you can't.
It's hard to tell. It's hard to tell which had an impact.
Exactly. And in some countries right now that are putting in restrictive measures like the stay-at-home orders, and these large-scale movement restrictions, those are definitely buying countries some time to prepare. But what is more important is what are you doing with that time? How are you using that time to ramp up your testing? How are you using that time to build your workforce to find cases? If you don't
to order shelter in place, for example.
Yes. And if you don't use that time wisely, when you lift these measures, the virus is going to take off. So what do you have in place to actually find it once you do lift these measures? Because they're all temporary. So I think one of the things I've seen in some of your interviews and your discussions with people is that people are feeling quite overwhelmed by all of this. And I think that's normal. And I think people need to understand that that's normal, but this is temporary. Like we will totally get through this. We may not see the light at the end of the tunnel at the moment, but we will get through this. I don't know how long you've been at home.
Like 5 weeks.
5 weeks,
Five
but
weeks.
someone's telling you.
Yeah,
But we are,
honestly, I don't even know what day it is half the time, Maria.
I'm the same. I'm the same. I don't know what day it is either. But you and I are very, very lucky. And many people in the
I
United States
agree.
very, very lucky. We have families and homes and places that we can stay home in and shelter. And the rest of the world, much of the world doesn't have that. And so with all this criticism, with all of this news, our focus is we have even more so double down on what can we do to protect people who aren't as fortunate as you and I.
No, I
And
agree. Every morning I think that too. And if ever I complain, I think I am so fortunate. I think everyone who has shelter, who has food, I think about all the people who have lost their jobs and worried about putting food on the table and how traumatic that is for them. But real quickly, Maria, before I move on about sort of the re-entry phase and the conditions that have to exist for getting back to perhaps a new normal.
a
Um,
new norm.
what would you say if you had to say, gosh, what could the WHO have done differently, knowing that you're going to have a full kind of evaluation? Is there anything along the way that you, as somebody sort of in charge of this, felt like maybe I should have done that differently?
I think from my point of view is how do we reach people with the messages that we have? I mean, if one actually went through all of our press conferences, all of our statements, you would see what we've been saying from the start. Um, that doesn't make the headlines. It's not as interesting as a headline story. But I think we all need to, those of us in public health, we need to figure out ways that we can reach our populations better. Like, how do we make that connection with frontline workers better? How do we make that connection with ministers of health and decision makers in countries? And I think that's where we really need to look at different modes, different methods, putting out guidance. So my team generates guidance. We have more than 50 documents online right now. I can't tell you how many people have said to me, does WHO have any guidance on this or this or this? And of course, but people aren't reading it. So how do we reach the people that need that advice? And secondly, how do we make that advice applicable to every situation that's out there? So at the global level, we put out guidance for all countries. And that's challenging because you have so many different economies, you have so many different populations. How do we tailor that to
Mm-hmm.
everyone who needs it? But
Especially, I was going to say, especially in a media landscape that has become increasingly fragmented, with people getting information from so many different sources. It would have been easier back in, the 70s when there were a few networks. I'm not saying that was preferable, but I think it's very challenging to make sure you're getting people where they are. Uh-oh.
we've
Wait,
reached out
Maria.
to
Oh,
Google
there.
and Facebook and
Sorry, I
TikTok.
lost you temporarily.
Oh, yeah, I'm there.
Go ahead.
No, I was just saying, like, we've gotten creative with when we reached out to Google, TikTok, and WeChat and Viber, and I'm gonna forget all the ones that we've reached out to, but like, there's so much out there now. It's just how do we utilize and harness that amazing ability to reach people? We've done chat bots. We've done apps. We're helping people with trainings and
Right.
interactive stuff.
Oops.
Um,
Sorry. Yeah.
that's on us. Technology is not the issue, and it's
Wait. Sorry, Maria.
a negative
You're starting to break up. Hold on two
thing. It's just
seconds. Hold on.
how do we use it to help people who are in isolation?
Yeah. Hold on, Maria. We're having a little technical problem. Let me see if I can move.
Yeah, it did.
Oh, it did. Hi, Maria. We're frozen.
Yeah, hear me.
You could just email Maria. I first said, thanks. Thanks. Hi, everybody. Sorry. Are you guys on here? We were just talking to Maria, and then we were having problems. Okay, hi everybody. We're back. We're just going to finish our conversation with Maria Van Kerkhove of the World Health Organization. I'm just getting books to stack up in my makeshift little studio here. Hi everybody. Hi again. Let me put this down. Maria, let's see if we have Maria. Hi, everybody. Sorry, we changed locations. Let's see if Maria is going to join us. I don't want to keep her too long because she's exhausted. It's 9 o'clock. There she is. Okay. We're waiting for Maria. If you guys, sorry, I'm not getting, hi, Maria. Sorry. I think
That's okay.
I was having bad Wi-Fi. The Wi-Fi service here is not very good. Anyway, sorry about that. I'm only going to keep you about 10 more minutes because I want to let you go, Maria. Can you hear me okay?
I think so. Yes, it's a
Fantastic. It's okay, fantastic. Again, and you may not want to answer this question, but do you think that HO so he to take responsibility for anything that he might have done wrong?
Well, yeah. So I definitely that's a difficult question, but I think now is not the time for that. I mean, for us now, we have to be resolved and focused. I'm a scientist. I come from this team. I educational background and academic background, and what we need to do is we need to focus on how many lives can we save.
Yeah.
Lives, American lives, European lives, African lives, Latin America, everywhere. And what can we do to do that? And that's what we need to be focused on right now.
I think that's a very smart answer, Maria, by the way. And I don't think you're even being political. I think you're just being very honest. Let's just talk quickly about reentry and the new normal, as I mentioned. What are your concerns about bringing sort of business as usual? Someone keeps asking me where the transmissions are occurring, by the way, and that person has asked me about 5 times, so I don't want to ignore him or her. So where are the transmissions occurring?
You mean in general, or you mean in
Yes,
the US?
I think in general.
So yeah, I ask this question everywhere I can. So with past coronaviruses, SARS and MERS, a lot of the transmission happened in healthcare facilities. And so from the beginning, that's what personally I was worried about, the organization about, that you would have these massive outbreaks in hospitals. And with COVID-19, what we're actually seeing, most transmission is happening in households. It's happening between very close contact with people who are, in very close proximity to each other through these respiratory droplets. It's not circulating in the air like on the street or in the park or something like that. It's very, very close contact. So most of it is happening among family members in close contact at home.
That's so interesting because I know I've read a lot of articles about whether or not the virus can become aerosolized. How do you say that? Become aerosolized?
Aerosol. Yes, and it
whether
can.
or not it can. Yeah, sorry, go ahead.
It can. So the thing that we worry about are what we call aerosol generating procedures. And these are things that happen in hospitals where you intubate somebody, where when you aerosolize the virus, you basically make these big droplets, which are still tiny droplets, even smaller. And the smaller the droplets are, they can remain suspended in the air.
Right.
And if you do procedures in a hospital, if the virus is in the particles, can stay in the air for a while. And so in hospitals, we recommend what we call airborne precautions, healthcare, because it can be aerosolized. But study after study that we're seeing is we're not seeing that aerosolization, if you will. That's probably not a word. In house, in normal coughing and normal sneezing. And so that's important for people. Are you having time with your wife?
Okay. No, this time I'm just having trouble keeping my phone straight. I mean, it's always something, Maria. So a lot of people are asking about a mutation that occurred in India. And I'm wondering what you know about that, if you've heard anything about that.
So what I know about the viruses is that there are very, very smart people, much smarter than me, virologists, who are looking at the full genome sequence, thousands of sequences that have been made publicly available, and comparing them. And what they do is they look at the changes in those viruses. And because this is a virus, it's an RNA virus, little changes are normal. This virus is relatively simple so far. So
Yeah, I read that too, because everyone, I think that word mutation is
yes,
super scary.
it is.
You know, and everyone hears that word and it's like, oh my God, once we solve this virus, it's going to mutate to another equally deadly virus. And I read
Well,
a few weeks ago that that's unlikely. And I think we could put a lot of people at ease by explaining that, Maria.
yes, and I think the thing that I take comfort in is that we have a network of people who are looking at this all the time. And so we are in regular communication with them about this. I mean, you and I have both seen the movie Contagion. We've both seen
Yes.
Outbreak. We've both seen all of these. We are not living in a movie right now. I know it might feel that way. And sometimes I feel that. But this virus is stable, relatively stable. Normal changes, and those changes are expected. But the changes do not reflect a change in transmission or a change in virulence in terms of its severity and the disease that it causes.
So people don't need to worry too much about this particular virus mutating.
No, they don't. They don't.
Okay, because I think people ask about that a lot. So I know we want to wrap things up in a moment, but a couple of other things before we talk about reentry real quickly.
Sure.
What about the results? I know you guys are waiting the results from these randomized controlled trials, seeing whether hydroxychloroquine, which
Yes.
it is that the president keeps calling a game changer, whether or not it's effective. Um, there is apparently currently no evidence that it works. Can you tell me sort of what is going on with that?
Yes. So there are hundreds of clinical trials that are ongoing right now. And on the one hand, that's unbelievable. I mean, to be 4 months into a pandemic of a new virus and having these clinical trials underway is a triumph. I mean, we should acknowledge that and be grateful for that. On the other hand, that means that there's a lot of studies that will have very small sample size. That means a small number of patients that they're evaluating. What
Right.
we're trying to do is we're trying to look for the larger studies that are done in a controlled way, where you look at people that receive the drug, you look at people that didn't receive the drug, and they have to be of similar, and then you compare what happens in terms of safety and in terms of efficacy.
Right.
And we
But it,
don't have studies yet. We don't have them yet.
well, what,
Uh,
I mean, you must have early indications. I imagine that's a luxury that we can't necessarily afford to wait for, Maria, given these current circumstances. Are you getting indication that's working? Are you getting any kind of data that would cause you to give guidance? Like, this is my friend, Dr. Allison Ocean, who's an oncologist and a good friend of mine, said the verdict is still out on it. But I
if
mean, aren't we getting any kind of sign, you guys?
if we had that data, we would announce it from the hilltops. We wouldn't hold back on anything like that. But what we have to ensure is that any drug that is being tried for COVID-19 is done in a proper study so that we can evaluate those results appropriately. And that's the challenge, is that we have launched what we're calling the Solidarity Trial, looking at a number of different drugs. As soon as we have results that are robust enough to do that, we will change our say this works, this
Yeah. Let,
doesn't.
sorry.
But until we do so,
Yeah, sorry.
it,
We're having still little
it,
Wi-Fi
it,
problems. I don't know whether it's you or me or both
it's
of us,
that we
but
wait.
it's okay.
That's okay.
Maria, is there any indication I meant to?
I'm on my. I'm
Oh,
not
well, this
using.
is great. Wait, before we go, I also, sorry, I meant to ask you earlier. Do you have any indication if you get it once, you'll be immune to getting coronavirus or COVID-19 again? What are you seeing in that data?
So that's a question I get all the time. I get from everyone that I speak. We don't know yet. Expect that people who are infected with COVID will develop an immune response, so they'll have some protection. I don't have the data to be able to say how strong that protection is,
Uh-huh.
or how long that will last. We've seen some early data from one study here, one study that suggests that some people have a very strong immune response and some people don't. So again,
Let's see. I just took you off Wi-Fi. Maybe that'll help from my end. Can you? I know you guys can't hear. Oh, she left. Okay. Do you guys want us to come back and finish this up? If you want me to call her back and we can talk a little bit more, I'll do that. Okay. I'm going to call her back for those of you who might find this useful. Hold on. Okay. Let's see. All right. This is modern technology. You're back.
okay. Okay, I'm not using my Wi-Fi. I'm using my 4G because I was afraid I would lose you. So can you hear me?
Yeah, I can hear you. It was awesome. Can you hear me, Maria?
Yes.
Okay, it was awesome for the first 20 minutes. So thank you for your patience. Everybody really appreciates. People want you to come on once a week at least and talk to me. So maybe we can do this again. So you're saying that what I understood is some people are showing immunity, some people aren't, and it's too early to tell if in fact it will prevent you from getting infected again if you've gotten this disease once.
Correct. But people who are infected from this will have some level. Can you hear me?
No. Yes, I can hear you. Sorry. At first I wasn't. Now I do. Okay. All right. So yeah. Sorry,
Okay.
everyone. Maria is such a good sport. You're such a good sport. Maybe, I think I can hear you a little better when you're a little bit back. Maybe that has something. I'm not good with technology. So let me ask you, Maria, about reentry. I know they're sort of, you're the head of the WHO, Director General Tedros. I can't pronounce his whole name. Outlined a checklist for reentry. Transmission of the virus should be controlled. Surveillance systems should be in place. Outbreaks in hospitals and nursing homes should be minimized. Yes. Preventive measures in essential locations such as schools and workplace. The risk of importing the disease from abroad should be under control. So that's a tall order, right?
There's one more. There's one more, that communities must be fully engaged.
Oh, okay. I don't have that one. Okay. So what are your concerns about kind of starting the economy or starting life as we knew it? Oh, she can't hear me now. Hold on. Yeah, did you turn off your Wi-Fi? Yeah, she did. Yeah. She turned off her Wi-Fi, everyone. She's just on 4G. Can you guys hear me? Hi, can you hear me? She left again. Okay, we're gonna do one more try and then we're gonna let poor Maria go, everybody. Stand by. Okay. Okay.
Okay.
Now I feel like you're perfect.
Okay,
Can you hear me?
we're good? I can.
Yeah, I
Yes.
think we're good. Okay, let's just give it a try, and then I'm going
Okay.
to let you go and get some rest. But by the way, one gentleman keeps asking me about Africa, and I don't want to ignore him because he's asked me many times. What do you think is the future for Africa?
Well, that's a big question. So we're working with our regional office in Africa to make sure that all of the countries in Africa have the ability to detect cases, gear up their workforce so that they can find cases, build treatment centers. We have a flight going right now to 51 countries, bringing essential medical equipment, including personal equipment and laboratory kits to countries across Africa. Many countries in Africa right now are seeing small numbers of cases, and there's still an opportunity to stamp this out. There's still an opportunity to prevent it from really taking off. So we're working really hard on trainings and on building that capacity to be able to fight this.
That's good to know. So Africa may be benefiting from the lessons learned in other countries.
Well, I hope so. I mean, I think that's a lesson for all of us. Like we're all a part of this. I mean, every single one of us is a part of this, and we need to be learning from each other. We need to be listening to each other. We need to be helping each other. I know many people are feeling incredibly isolated, but there's a lot that we can do to feel connected in some way. What has happened in Asia, what has happened in Europe, what is happening in the United States and in Canada and in Central and Latin America. I mean, we all need to be learning from all of these lessons. None of us are immune to.
And what is your biggest concern, Maria, about reopening things quickly? I think people are really worried about a second wave, about this coming back in the fall, and everyone is desperate to get back to their lives, normal lives, but obviously they don't want to making themselves or their loved ones sick. So, can you just give us some final thoughts on when we can expect life to be kind of back to normal? I don't think Maria can hear me, everybody. Can you hear me, Maria? Can you hear me? Yeah, she can't hear me. Do you have, okay, I wish I knew sign language. Here, hold this. Hold this. Maria, thank you. Thank you. Let's try to do this again, you guys. I think Maria is one of the smartest, most eloquent people I know. And if you guys want me to do it again, that's okay. Thank you. Thank you so much. How do you say thank you in sign language? Isn't it thank you? I think that's sign language, but I'm not sure. Okay, I'll call you. I'll email you. All right, thanks everyone. Okay, bye. Bye.